I've been asked really today to speak about politics and the issue that we're addressing, harm reduction. And interestingly, there is, in fact, some similarities between what we would call politics and what we would call harm reduction. So, which is the one that goes forward, Alex? Is it
it's the
the green one? Politics. How to make things happen in a world of conflicting interests and ideas. In fact, one of the very important points I think that we need to make about the difference between what Alex called the consequentialist approach and the deontological approach is that actually there are conflicting values. People have different ideas about what the good society should be. So you start off with a problem. And so just to say, I've got a principle and I'm going to pursue it, usually you've got 2 or 3 principles. So you're going to have to work out how they fit together in the first place. But politics, it's the science of power and influence. How to make something happen. And what we wish for may conflict with what we can reasonably expect to achieve. That's the world of politics. Some people are good at it, some people not so good at it. It's absolutely fundamental. An understanding of politics is absolutely fundamental to any serious discussion about making change in the world. And then there's harm reduction, which I've defined as followed how to reduce the negative consequences associated with the choices we make and the habits we have. Unfortunately, when I'm watching television and there's an advertisement for chocolate, I want to get in the car and go and buy a block of chocolate. We get these habits and they're part and parcel of our lives, and we want to reduce the negative consequences that may be associated with them. It relies on research and evidence about what works and what doesn't work. And it's political, because as the last 2 speakers have just pointed out, it's contested. Not everyone agrees with what we would call a harm reduction approach. How dare you, say the critics, assume a world that's less than perfect? How dare you assume that these creatures of God can't create perfection on this earth according to the will of that God? And God may not be God up there, God may be human history. It may be a secular version of perfectibility. It doesn't have to be a religious version of it. And so it's at the start it's political. But note the similarities here. Politics, the world's not perfect, there are conflicting interests. You try to work your way through to create a good result for people. Harm reduction, we start with how people actually live, the choices they're making, the habits they have, and we try to just make that world a little bit safer, if you want to use that expression to describe harm reduction. And Alex went through all of the examples that you can use for that. So there's a similarity between politics and harm reduction. But the big issue is, of course, this distinction between what we'd call a pragmatic approach and a fundamentalist approach. There is a view that we should treat the world as capable of perfection. And as soon as we diminish our expectations about what human beings can achieve and the sort of society that they can create, as soon as we do that, we've taken a backward step. And there are so many examples in history of this, and the one I'm just quickly going to mention and not go into any detail is Florence. That's Florence in 1498. That's the Palazzo della Signoria. And what's happening there in the middle is the burning at the stake of a radical priest called Savonarola. This is the man. He believed that Florence had decayed so much that a renewal was needed. And he fell out with lots of people in the church, including the Pope, who eventually got the better of him. Therefore, he was hanged and burnt at the stake. He wanted a perfect society. And this is the sort of things that he did. Just to read very quickly from the history. He had gangs of young people going around checking up on people. A Offenders, including blasphemers and sexual deviants, were punished by torture. He organised young boys to help enforce his policies. They roamed the city collecting love songs, profane books, carnival masks and other immoral items which were piled onto a pyramid 60 feet high, thus the bonfire of the vanities. Remember the famous book? That's the origin of it. Now, people got sick of this. They thought it was great when he first came into power because he did extend power to the people. As you know, Florence at that time had quite a democracy. Not equality, but certainly democracy. But it all went bad. And eventually he went, and in back to the office, that office there, the Palazzo de Vecchio, Machiavelli. 2 months later, went into that office. And of course, Machiavelli had a completely different view of the world. This extremism, as opposed to taking people as they are, rather than as we would like them to be. Men are thoughtless, said Machiavelli. This is a quote from the Prince. They'll opt for a diet that tastes good without realising there's a hidden poison in it. This is real life. These are the real people of the world we live in. And that's it. You have to base your assumption on the fact that there's generosity, but there's also greed. There's rationality, but there's also irrationality. There's leaders and there are followers. That's the world we live in. Unfortunately, that's it. He was a reformer. He wanted a better world. But he understood. And that debate goes on today between the fundamentalist who's got one big idea that everyone should have as the basis of their life, and we will do everything to make that happen, versus those who say, look, let's treat the world as it is and let's try and make it a better place as best we can. Make it a better place for the people that live in it. But I think what goes to the core of David's point, I think, why he said to people object to the change so much, I think within the human mind is this desire for perfection. And it's understandable. It's in some ways a good thing that we try to make for a better world. But can we have a perfect world? And just even now, I bet you're saying to say, how can he say that? How can we say that we shouldn't try to achieve a perfect world? Well, we still can, but we need to understand the context in which we're doing it. We need to understand the realities of human nature, because if we don't, that wonderful idea we have may harden our hearts so much that a whole group of people become expendable. Marginalised drug users, sex workers, people outside the mainstream, expendable. Because they're obstructing us on the path to perfection. We've seen it with communism. Wonderful idea about people coming together and sharing the products of their labours. Harden the hearts when someone says, well, perhaps we can't do it. Oh, he's opposed to the way forward. In jail he goes, or does he get tortured or whatever. So this is the reality of the society. Now, I think the other point I'd make about David's presentation is that there is a sense in which science is also now part of this. Because medical science has told us a lot of things about what we do, about the actual and potential consequences of using drugs, smoking cigarettes, drinking alcohol, overeating perhaps, not exercising. They've given us a huge amount of information, and it's all going into the heads of individuals. They're talking about these things with their medical practitioners, with their families, and you know, part of that discussion is you shouldn't be smoking, you shouldn't be doing this, you shouldn't be doing that. And that's one level to the whole argument. An individual and their medical practitioners, individuals in their communities making decisions about all of these issues. But the issue we've got to develop, we've got to tackle here at this conference is government policy. There's a difference between a medic and an individual talking about their health, and the government and all of those individuals and medics. How far can that government go in intervening in that process? So medical science gives us a lot of information. The individual and their medics think about that, but then there's the governments and their role. Some people are completely libertarian, get the government out. Some people are completely paternalistic, have the government in there every day watching over what you do. And that's the battle. And it's a difficult one because of the real realities that we work in. But all I wanted to point out today was, once it gets into that arena, there's a science connection to it in terms of what medical science tells us we should and shouldn't do if we have a particular objective, and what governments need to do in relation to all of those issues. Because as soon as you get into government, let's imagine this table here is the cabinet table. Martin Foley's in there, the minister. They're all sitting around that. Who's at that table? Well, at that table there will inevitably be an ideologue. And the ideologue will be, as David said, someone who knows what the truth is. They don't need any evidence. They know that if you do this, that's the good thing. Because they're ideologues, they're ideologists, they're fundamentalists. Then you've got the vested interests. They usually don't tell you what their interest is, but they'll have one, and they know they've got to defend that interest. Then you've got your people that say, what do the mob think about this? We'll just do what the mob want, because that's the best way to go. And then there are the researchers who do their evidence and they throw it in on the table. So the problem we have, if you've got those four influences, you've got the vested interests, you've got the populists, you've got the ideologues, and you've got the scientists. And the leader who chairs that meeting has got to bring it all together. So you've got to convince the leader, or the ministers have to convince the leader to make sure a conversation can be had that can progress us forward around a harm reduction approach, which, as Alex pointed out, is something that's quite controversial at the best of times. My final point, we're living in a society where there's a mixture of prohibition, illicit drugs. They're illicit drugs, that brings it straight into prohibition. You've got harm reduction, you've got supply reduction, you've got demand reduction, alcohol, bits and pieces of it. In cigarette smoking, there's been huge efforts put in. There's been a reduction in cigarette smoking, but it's still there in our community, and it's a whole mix. There's not one theory or the other theory that dominates, but harm reduction provides a shining light amongst them all because it's got this remarkable habit of improving the outcomes for people. A remarkable habit of doing that. When they did the Portuguese decriminalisation, they can now show that their health outcomes have improved in very clearly identifiable ways. We've been able to show with the injecting centre in Sydney now, here in Melbourne, as the Minister said, clear improvements. Harm reduction's like a shining light in a world of cynicism and interest. It can produce good results, but it comes up against fundamentalism. And it comes up against a very, very important aspect of human nature, and that is desire to make the world perfect. Religiously driven or ideologically driven, doesn't matter, it could be either of them. So when we look down on this world, what should we try and get out of it? Well, this man said, Karl Popper said, what we want to get out of this world, the best we can hope for in the world is not to make everyone happy, because happiness is a personal thing in many ways. It's individual. There are different ways that people want to be happy. We should allow them to seek that happiness. He was totally against authoritarian control over people. But the best thing we could do in government is to reduce the harms and the avoidable suffering. So, in a sense, Alex, I think this goes to that point of the pleasure. I think harm reductionists don't talk about pleasure so much because, in a way, that's for people to do. That's for their interest. And they should have a degree of autonomy, a degree of freedom to be able to do that. But when it comes to what the government does through law and regulation, it's most important, I think, that the focus be on taking out of the system real suffering and harm. And of course, you judge that on the basis of either, you judge that on the basis of human rights principles, the World Health Organization definition of what health is for the individual, and you try to bring the best out of it. So our role, I think, in a conference like this is to say to ourselves, this is the situation we now have. These are the outcomes that we see from it in human rights terms and in terms of human health. What can we do in that situation that will make a better outcome by reducing the avoidable harm and the suffering associated with that harm? And when you look at that, harm reduction really comes out very strongly as an important, as I said, shining light in an otherwise difficult scenario, a difficult situation. And so we're then left with the final challenge, which is to make it happen. Now, you've all heard of Albert Einstein, of course, and you might not know that he had a particular view on politics. He was once asked this question. It was in Princeton University in 1946, and the students had him then. They said, Professor Einstein, why is it that when the mind of man has stretched so far as to discover the structure of the atom, we have been unable to devise the political means to keep the atom from destroying us? That is simple, he said. Politics is more difficult than physics. He understood. More difficult, I would add, not just because of the fickleness and contrariness of human nature, which Machiavelli exposes to us so clearly, but also because of the prejudices of those who advise and those who seek to govern. Only through constant and consistent effort in the interests of harm reduction, issue by issue, step by step, program by program, there'll never be the perfect outcome. But all of those little changes that we made, some bigger than little, I think can start to break those prejudices, because we can see in practice, as well as in theory, that real people are surviving. They're not dying in the back streets of North Richmond. Their health is improving as a result of the opportunities they have through harm reduction. And so I think that's the message I'd like to leave with you. Step by step, issue by issue, harm reduction will produce benefits for our people. Thank you very much.
Thank you, Geoff.